I'm very pleased to be here today to share a little bit about mindfulness-based cancer recovery and mindfulness for people coping with cancer and their loved ones. So I'm going to tell you a little bit, first of all, about what is mindfulness, how do we think about it, how do we define it, and then talk about how we incorporate mindfulness into interventions to help people learn the skills of mindfulness and apply them to their lives. And then specifically, I'll tell you about our program called Mindfulness-based Cancer Recovery, and just a little overview of what the research results tell us about how it can be helpful for people. So first of all, where am I anyway? Through the magic of Zoom, I am talking to you from just outside Calgary in Canada. And the work we have done is at the Tom Baker Cancer Center. And what the Tom Baker Cancer Center is, or I'll tell you in a moment about our new cancer center, which is right behind me in the photo. So we have public health care in Canada. So the Tom Baker serves the southern half of the province, around 2 million people. And it's a full service cancer center with surgical, medical oncology, radiation oncology. We do bone marrow transplants, hematology. We serve about 8,000 people a year, about 25,000 visits. And within supportive care, which is where I work, we have psychosocial oncology, palliative care, spiritual care, rehabilitation, as well as dietitian, social work, sexual health. So full service cancer program. I'm really excited actually because we just moved into a brand new cancer center called the Arthur J. Child Comprehensive Cancer Center. That's it there in the photos. We have an integrative oncology department that I lead up. It's the largest cancer center in Canada. And it's gigantic. And so we have one of the best, strongest psychosocial and integrative oncology programs in Canada and North America for that matter. All right, so that's where I'm coming from. Now let me tell you a bit about what is mindfulness, because I think there's lots of misunderstandings and misconceptions people often have. So for example, if you read Time magazine, you might think that practicing mindfulness turns you into a blissful, young, beautiful woman. Well, perhaps that's not quite the case. We define mindfulness as paying attention on purpose in the present moment with an open and accepting attitude. So mindfulness is two things. It's a way of being in the world. So we can be more or less mindful no matter what we're doing. It doesn't take extra time to live our lives in a mindful way. But it's also a practice and a skill that we need to develop, just like playing piano or playing a sport. So this cartoon illustrates mindfulness as a way of being. So who's more mindful, the person or the dog? You can see the dog just sees what the dog sees. The person's mind is cluttered. So in fact, we can learn a thing or two from our pets. This picture illustrates the practice of mindfulness. So setting aside time to sit down and practice meditation, which allows us to cultivate the skill of being mindful, of paying attention. So why wouldn't we be mindful? What's your mind doing instead? So we have anywhere from 50 to 70,000 individual thoughts every day. And research has shown when you survey people throughout the day, and I often ask people this, how much of the time do you think you're actually paying attention? And they laugh and they say, I don't know, not much. But it's about half the time that people report not paying attention to what they're doing, so not being in the present moment. And the interesting thing is that when people are in the present moment, they also report being happier, no matter what they're doing. So you can be washing the dishes. If you're paying attention to that, you feel better than if your mind is wandering when you're washing the dishes. And why is that? It's because of where your mind wants to go. So like this woman, your mind might be going off to the past. So for her, she's thinking, oh, why me? If only this or if only that, things would be different. She's having regrets. She's feeling sad. Maybe she's getting angry. Okay, because her mind's in the past, regretting things she can't change. Or you might be like this guy. His thoughts are going to the future. And he's worrying and thinking, oh no, what if this happens? What if that? How am I going to cope? He's feeling stressed and he's feeling anxious. So if your mind's playing out all those scenarios in the future, you're going to be stressed and anxious. So when you're in the past, you're in the future, you're not living your life and paying attention in the present moment, where most of the time, everything's okay, more or less. So we need to learn how to be more focused in the now rather than in yesterday or tomorrow. And that's really what the core of mindfulness is about. So we use a lot of poetry to practice mindfulness. This is one of my favorites. I went to the woods because I wished to live deliberately, to front only the essential facts of life, and see if I could not learn what it had to teach, and not, when I came to die, discover that I had not lived. And that's the true tragedy. Everyone dies eventually, but do we want to be able to live our lives fully for whatever time we have? So we can think of mindfulness as existing in three components: the kind of why, the what, and the how. So that's our intention. In our simple definition, it's just doing it on purpose. And our purpose may vary over time with our practice, but we need to set an intention. So that's why we do it. What do we do? The skill of mindfulness is paying attention. So this is where the practice teaches us the capacity to notice when our mind wanders and bring it back to the present moment over and over again. That's what we do to train our minds to be mindful. How we do it is equally important. The attitudes we bring to it, being open and accepting. And let me elaborate on that a little bit more. So some of the core mindfulness attitudes are being non-judgmental. And this is mostly around ourselves and our capacities and our ability to learn something new, to be mindful. Letting go of all the evaluations. I can't do it. I suck. I'm no good at this. Patience. So we all want a quick fix, but a practice like this, transforming your mind, it takes time and it takes patience. Acceptance. So nobody wants to be dealing with cancer. There's many things in our lives we didn't choose, but just because we don't like it doesn't mean it's not happening. So needing to accept the difficult things. Yes, I'm in this situation. Yes, I have to cope with it. Yes, I feel rotten. I'm scared. I'm afraid. That's all okay. We can hold that in the container of mindfulness with kindness and acceptance. Letting go of things we can't control. Non-striving, again, letting go of needing things to be a certain way and being so goal-oriented. The goal in mindfulness practice is to just be in the moment. Trusting the process, trusting your own wisdom, trusting the practices that have been around for thousands of years. Beginner's mind is approaching things and yourself as if for the first time. Reimagining that joy of the child as they see the first flower in the spring. So seeing the beauty around us again. And people often say it's a tall order, all these attitudes. It's the opposite of what I've learned in my life. And we can think about the opposite of these attitudes. What really would that be like? It would leave you as a judgmental, impatient, rejecting, grasping, striving, suspicious know-it-all. And maybe that describes you or someone you know, but it's really a recipe for stress and unhappiness. So as I said, there's many misconceptions about mindfulness. So mindfulness is not about feeling relaxed. Although you may feel relaxed in a mindfulness practice, that's not the objective. It's not a form of hypnosis where someone's altering your mind state. It's not a religious practice or a form of prayer. It's a secular practice, but it can be incorporated in any religious tradition a person may come with. It's not clearing your mind of all thoughts. It's about paying attention to your thoughts with kindness, even the tough ones. So it's not always peaceful and calm. Mindfulness is a container for all the tough emotions, noticing the shifting, the changing, the moving, the thoughts rising, the thoughts fading away, all sensation rising and falling. So it's about awareness and those attitudes of kindness, acceptance, non-judging. So now I'm shifting for a moment to mindfulness as an academic pursuit to get into the science of it, because that sounds all very new agey, perhaps. But this graph shows you scientific research studies in academic journals using the term mindfulness in the journal titles. And you can see there is an exponential growth here right around the year 2000. That's the year we published our first study of mindfulness for people with cancer. And at that point, I could read every paper for many years. And then it really took off about 2010 from, under 100 papers a year to well over 100 to 500, 600, over 1,000 in the last few years. So the academic study of mindfulness has taken off, and the prevalence or the awareness of mindfulness in the general public even more so. So now is a time where we will do a little practice of mindfulness. Now, we're not going to change anything. We're just going to pay attention to what's already here. So let's just take a moment. And often in mindfulness practices, we work with the breath, or we pay attention to the breath, because the breath is always there like a wave, rising and falling. So just notice how you're sitting. Oops. And if you're slumped over, maybe sitting a bit more upright, placing your feet flat on the floor. Nothing too extreme. And take one hand and place it over your belly. Okay, and just sort of feel the belly there without judgment. The other hand, place it on your chest. And now all we're going to do here, just for a few moments, is to pay attention to our breathing. Don't change it, just notice it. It's already here. If you're comfortable, you can let your eyes gently close or just soften your focus. Then just noting to yourself in as you breathe in and out as you breathe out. And notice where you feel movement in your body. So as you breathe in, you may feel a rising in the top hand or the bottom or both. And as you exhale, again, notice where there's movement. And notice if there's judging or evaluation, just letting that go. Be like a breath detective. What can you notice? How long is the in-breath? Is it smooth, or does it stop and start? Is there a pause between in and out? How long is the out breath? Are they the same or different? Is there a pause after the out breath? Or does it flow smoothly from out to in or in to out? Is there tension in the body, in the shoulders or the belly, the legs or the face? Just notice what's there. It's okay, whatever you find. Just keep breathing and noting to yourself in and out. Let your shoulders drop. Let your belly soften. And just pay attention to the flow of breath. And notice what your mind's doing. Is it jumping around from thought to thought, maybe the future, the past? That's okay. That's normal. As soon as you notice your mind off your breath, away from your body, just lead it back kindly. Back to noting in and out. Okay, just a few more breaths here. And as you're following the wave of breath rising and falling, just noticing any changes that may happen all on their own. Just from the act of focusing the light of awareness on breath, on body. All right, now lowering your arms, opening your eyes if they were closed, and just taking a moment to reflect on what you noticed. And you can ask yourself, where was the movement? Was it more in the upper hand or the lower hand? Was it even? Did you notice any shifts or changes as you paid attention? What was your mind doing? Did you find it going off to the future? Was it thinking about the past? Was it judging or evaluating? So noticing these things without judgment, just kindness. We don't judge the judging, right? So some people notice in that exercise, and when I do, I would share, but some people notice that, yeah, mute that, please. Some people notice that maybe there was more movement in the top of your chest. Maybe there was tightness in the belly. Maybe the mind was crazy and you had to keep coming back. And often people notice that as they pay attention to the breath, it just automatically begins to even out. And if you can exhale and release tension, your body will soften. And the body has a wisdom. If you just let it breathe and pay attention, it will find a place of balance. So let's talk now about how mindfulness like this can be applied to people with cancer and their families. So why would this be an appropriate type of program? Well, let's think about the core elements of having cancer. So this here's our spider visiting the psychiatrist. Doc, you got to help me. I just seem to be spinning out of control, right? It's fine if you're a spider, but that feeling of loss of control is central, a core feature to having cancer. We tend to live our lives thinking we have some say in the matter, that we have more control than we actually do. And so an experience like this points out the fact that there are fewer things in our control than we had thought. And that can be frightening for many people to accept that. Of course, there's the life threat and the threat of earlier mortality. And so again, we all know we're going to die, but we don't think about it in the front of our mind. We don't have to actually face the fact it might be sooner rather than later. So no matter how good the prognosis, and of course we know these days most people are surviving longer than they ever have, it still makes you think, oh my goodness, I might die from this. What does this mean about my life? Have I lived a good life? Am I afraid of death? And then the loss of certainty and predictability and routine. If you're taking cancer treatments, you might need time off work, everything's turned upside down, your family's having to help you more. So that familiar routine is out the window for a while. And there's lots of emotions. There's sadness and grief and loss. There's fear of what the future holds. There can be anger at oneself or other people. There can be sadness and depression or even guilt and shame. All kinds of feelings arise, and that's normal. Then there's the symptoms of the disease, dealing with pain, fatigue during and after treatment, difficulty sleeping, just some of the symptoms. And then again, no matter how good the prognosis, there's always the worry, is it going to come back? How will I know if it comes back? What does this ache or pain mean? And so there's this constant monitoring and anxiety around symptoms and side effects and what does this all mean and what if it comes back? And so for some people that can be very drastic and interfere with their lives. And so the things we learn in a mindfulness practice that are really briefly overviewed, like regulating, noticing and regulating our emotions, those attitudes I talked about accepting difficult emotions, accepting the circumstances we can't change, letting go of the need to control, compassion for oneself and one's suffering. All of these are components of this program that help deal with these specific features of living with cancer. So we developed a program based on mindfulness-based stress reduction, which is a very famous program developed by Jon Kabat-Zinn back in the late 1970s. We adapted that and called it Mindfulness-based Cancer Recovery. And these are real people in one of our real programs. So we started in 1996 with some of my colleagues, Michael Specka, Maureen Angan, Eileen Goody, psychologists and social workers. And it was based on their personal practice of yoga and meditation. But I came along in 1997. I had just finished my PhD. And I had met Jon Kabat-Zinn and I knew about MBSR. And I said, hey, you know what? There's this thing that already exists. And so we adapted the MBSR model around 1998 and started offering our program. We do it in groups of about 15 to 20 people at a time, anywhere from 3 to 10 groups a year. We've had many thousands of people through at this point, and it's an ongoing clinical program, but we have research studies that we embed within the program and have done many, many of those throughout the year. So our program is now a 9-week intervention. We actually meet for 2 hours when we do it on Zoom, 1 or 2 instructors. And there's a format the program follows. There's usually a check-in, homework review, a discussion about certain topics, for example, the mind-body connection or, coping with thoughts. And then we do mindful movement practice, and we do different forms of meditation, and each week builds on the next. So the booklet is given to patients. It outlines the program. There's a reading list, and there's daily meditation practice throughout, which allows people to develop the habit, the skill of meditating. So they keep track of how long they're meditating. There's a longer silent retreat near the end of the program where we bring it all together. And so there's different themes each week. We introduce mindfulness. We really focus on the attitudes. Oh, by the way, this picture is right near where I live. I live near Banff, Canada. That's just around the corner from where I am right now. We talk about the wisdom of the mind and body and healing, the difference between responding to stress versus automatically reacting. We teach balanced breathing exercises people can use in everyday life. We talk about coping, the stories we tell ourselves, and how the stories and the interpretations of our thoughts can color our moods. We use some imagery to cultivate beneficial states of heart and mind, loving kindness and compassion. We talk about deepening and expanding practice as we near the end of the program, and then how to take this back into the world as a person finishes the program. So those are the different themes. We actually have written this into a book called Mindfulness-based Cancer Recovery that came out in 2011. I'm happy that it's in many different languages. Here we've got I think French, Dutch, Italian, German, and there's 2 versions of Chinese, both the traditional and the simple characters that are also available. And it's patient-centered. It covers the whole curriculum of the program with detailed exercises. So it's good to follow along if you're doing an in-person program or if you're not able to attend one. The book can help you. So as I said, we teach many different kinds of mindfulness practices as we go through the program. These people lying down, they're doing a body scan, they're not having a nap. They're actually training their attention to move through their body from the toes up and really paying attention to what the body is telling them, what all the sensations are. We do sitting meditation. You don't have to sit like a pretzel on the floor. Most people sit in a chair. Walking practice. Again, it's sort of another way to cultivate attention within the body. We do some open awareness exercises where we pay attention to everything happening around us. We use imagery like the mountain or the lake to cultivate qualities of mindfulness in ourselves. And we do loving kindness practice for ourselves and others. And we do movement. We think it's really important, and the research bears this out, that for people going through cancer during or after treatment, that they really need to reconnect with the physical body. And so often our thoughts are disconnected from our physical body, and we don't even notice, what the body's telling us when there's tension in the body. And so we really work to reconnect through the mindful movement. Okay, so I'll summarize the research results just broadly. Yeah, we're doing okay for time. So as I said, we started our research program way back in 1998. And this is the very first study that we ever did, was published in the year 2000. And what we did was what's called a randomized controlled trial. And all that means is that we took a group of people with cancer, 89 patients. No one had ever done this before. It's a brand new program. We just said, anybody who's interested, come on down. So they could be during treatment, off treatment. They had all different types and stages of cancer. And like a flip of the coin, half of them did the mindfulness group right away, and half of them waited. And then we assessed everybody before anyone did the group, and then we assessed them all after half of them had done it. And then you can compare the effects of the people who did the program with the people who were still waiting for it. And so what did we see? We saw improved symptoms of stress and less mood disturbance, but it was a really big effect. And we also saw maintenance over 6 months. So let me show you what this looks like on a graph. So here, the higher scores are worse. This is mood disturbance. So we have pretty high levels here. This is the mindfulness group in blue, the control group in red. They're the same at the beginning. After the mindfulness group does the program, while the others are waiting, there's a huge decrease in mood disturbance. And this is the magnitude of the decrease. So it was something like a 65% decrease in the mindfulness group, while the people waiting were about the same in terms of mood disturbance. And what does that mean? I don't have the subscales here, but there's 6 subscales: anger, depression, anxiety, confusion, vigor, all those things improved. Those are all the subscales that make up the total score. The other thing we looked at was symptoms of stress. And again, there's like 8 subscales, different types of stress, physical stress, racing mind, cardiovascular symptoms, all kinds of things. And so we saw a similar pattern. Lots of stress at the beginning. The people in the program afterwards decreased stress. Here about 40% decrease, and that's the change. So what we found from this, and again, no one had done this before, is that this was a very powerful, potentially powerful and transformative program. And so we began studying it even more. And so now I'm going to fast forward about 20 years and just summarize some of our research results. So we looked at these symptoms in people before and after, and I talked about stress and mood, but then we started looking at these other problems like sleep and fatigue. And sure enough, those problems were improving as well, significantly. We looked at what might be behind this, asked people if they were ruminating about the past or worrying about the future, and sure enough, that stopped or went down, and the changes in rumination and worry predicted these other outcomes. And we also looked at the partners, often spouses or children or friends who participated, and they also improved similarly. Then we wanted to look at, well, could we enhance well-being as well as just reduce symptoms? So we looked at things like quality of life, which improves. We looked at these things like spirituality and post-traumatic growth, which are more about finding connection with something larger than yourself, about finding meaning and purpose in life, about growing through a traumatic experience, using it as a catalyst to live your best life, and looking at people's ability to be mindful throughout the day. Sure enough, those things improve as well. We also poked and prodded people and took blood samples and did their blood pressures, and we looked at saliva. We measured things like stress hormones. I'll show you the blood pressure data in a second. We looked at cortisol, which is a stress hormone, throughout the day, and showed changes in patterns of cortisol, which is secreted as a marker of sort of stress response, and that decreased at the end of the day so people could sleep better. We looked at inflammation through cytokines in the immune system. Again, those parameters changed as well. And we even looked at something called telomere length, which is actually within the cells, within the DNA. There's these little ends of the cells called telomeres that shorten with cell aging. Shorter telomeres are associated with risk for different diseases, even with predicting mortality. And they also shorten with stress, excessive stress. And so we were the first people to show that telomere length could also be influenced by a mindfulness-based intervention. So this is the blood pressure effects I was going to show you. So this was very interesting because it depended if people had low or high blood pressure coming in. So if they came in with low blood pressure, there was no change. But if they started with high blood pressure, it went down. And this graph shows you how that happens. So here, these are the people at the beginning. So this is week 1, this is week 8. At the beginning, these people who had low blood pressure, it didn't matter if they did mindfulness, the dotted line, or waited. There was no real change. But if you had high blood pressure, these folks to start with, the people who did the mindfulness group, week by week, it came down to below the cutoff for pre-hypertension. This was the same magnitude of decrease as if you took a blood pressure medication. So that was really interesting to see. These are some of the media reports about the telomere data. So yoga, mindfulness, assist breast cancer recovery at a cellular level. So this particular study was with women who had breast cancer. And there was over 300 media reports about this. World first evidence suggests meditation alters cancer survivor cells. Scientific American, I laugh because it says changing our DNA through mind control. And I just told you meditation is not mind control, but the media gets all kinds of things wrong. But there was a lot of attention to that study. So we are not the only people who have done this work. There have over the years been dozens of other clinical trials that have looked at mindfulness-based interventions, is what we call them as a group. So let me just walk you through this. So a meta-analysis is just taking all the studies together and looking at their overall effects. So this one was with breast cancer patients. So there were 15 randomized controlled trials, so high quality clinical trials, almost 2,000 different people, and from studies all around the world. So not only in Canada, but in the States, in Europe, in Asia. And so what they found is medium, which is clinically meaningful effects on decreasing anxiety, decreasing depression, improving quality of life, decreasing fatigue, and this idea of post-traumatic growth I told you about, which is a way to sort of catalyze a difficult or traumatic event as a way to live a better life. And these 8-week programs that we do were more effective than truncated or 6-week programs that some people have studied. And this just shows you the results there. So here's another one that looks specifically on these positive outcomes, and there's the paper. So this one was even bigger because it was not just breast cancer, it was all kinds of cancer. And there was 46 studies, over 4,000 participants. And again, across all these studies, we saw large effects on improving mindfulness skills, improving well-being, self-compassion, the ability to cope, and also smaller effects on this meaning or personal growth, positive moods, spirituality, and also social support, because it's done in a group. And that's really beneficial for people as well. So let's see, that's a good time just to summarize now. We know that mindfulness is present moment, non-judgmental awareness, applying those attitudes, especially acceptance. It's a way of being in the world that's cultivated through formal everyday meditation practice. We first developed MBCR in the late 1990s, and we train people in mindfulness, and MBCR helps improve a range of outcomes that I summarize, like anxiety, stress, depression, sleep, fatigue, quality of life, and these biomarkers like telomere length, immune function, cytokines, stress hormones, blood pressure, a whole bunch of things. And I summarized by now dozens of studies on these mindfulness-based interventions show similar benefits. All right, so we will stop there, I think. Yeah.
Now with that, now as we come to a close of today's enlightening session, I want to take a moment to express our deepest gratitude to Dr. Linda Carlson for sharing her time, wisdom, and expertise with us. Her insights into the power of mindfulness in navigating the cancer journey have been truly invaluable. I want to also acknowledge the organizing team, Albert Tiong, Managing Director of the Center for Mindfulness, Sean Chu, Medical Partnership Director and Trauma Psychotherapist at the Holistic Psychotherapy Center, Devi Merchandani, Certified Mindfulness Teacher and Mindfulness Connector at the Center for Mindfulness, and also trained to teach the MBCR as well. A special thank you also goes out to each and every one of you who joined us today. Your engagement, curiosity, and willingness to explore mindfulness as a tool for healing and resilience make discussions like these so meaningful. Whether you are here as a patient, caregiver, healthcare professional, or simply someone interested in holistic well-being, we appreciate your presence and participation. I encourage you to reflect on what resonated most with you today. If you'd like to continue this journey, we invite you to explore further resources, join mindfulness programs, or share today's insights with those who might benefit. If you have any further questions, feel free to reach out to our team. You may know our website because you probably signed up for this event via the website. Write to us, and we will be uploading this video of the webinar onto YouTube as well. Once again, thank you, Dr. Carlson, for your inspiring presentation, and thank you all for being part of this event. May you continue to walk your path with awareness, compassion, and inspiring others. Stay well, stay mindful, and we hope to see you again in our future sessions. Take care and have a wonderful rest of your day. Bye for now.